Hi, Coach Nicole here, and I want to show you one of my favorite rehabilitation exercises that I use in the clinic that's great for helping with low back pain, helping to work on muscle imbalances, especially for the low back, the hips, and the legs. An often neglected muscle group are some of the deep hip rotators. So there's a two-part exercise that I like to show majority of my patients that's really easy to do at home or anywhere. I'm out in the park today, so figured I'd show you here. So you want to come to your side. You're going to have your knees bent and your hips bent. So hips are about at a 45-degree angle, knees about a 90-degree angle. You're going to start with your feet together with this, and this is called a clamshell. So what I want to do here is I want to bring my knee up without rotating from my back. I want you to come down so that you're flat here, and you're just going to bring that knee up like you're making a clamshell with your legs. Now you want to keep a slow pace and only go through the motion that moves your hip. You don't want to turn from your back. I want to stay nice and stable from my back and my spine. Now the second part to this is you're going to keep your knees together, and now you're going to lift your foot up. So now I'm training the opposite rotation motion in those deep hip rotators. And this is going to help balance out some of that strength deep in your hip, help with positioning and posture for your pelvis. And sometimes it can take some of the pressure off just in those areas where you're having some nerve pains coming down in there. Now, it's not to diagnose anything, and I would always recommend see your doctor or your physical therapist to help you with diagnosing any of those. But this is a quick and simple exercise that works a muscle group, a couple muscle groups that most people neglect and don't train, so it's really a good crossover exercise for most people to do. I would recommend starting with 2 sets of 10 repetitions, work your way up to 15 repetitions, and maybe go up to 3 sets. You're going to feel a nice burn right in here in the hip if you're doing it right, kind of in that hip and glute area, and that's how you'll know that you're getting it right. So clamshell, knee coming up, back staying stable, foot coming up is that reverse clamshell, and that's one of my favorite little rehab tricks and exercises. So hope that helps you out, and if you have any questions, click the link below. Be happy to answer any questions or help you out with it. And as always, remember, life's a sport. Train for it.